Absolute contraindications of OCP include congenital hyperlipidemia, thromboembolism, cardiac abnormality, false answer migraine, gallbladder disease. Details: absolute contraindication of OCP: cancer of breast and genitals, liver disease, previous or present history of thromboembolism, cardiac abnormality, congenital hyperlipidemia, undiagnosed abnormal uterine bleeding. Breastfeeding is contraindicated when mother is HIV positive, mothers receiving chemotherapeutic agent. False answer: mother is suffering from hepatitis B virus, baby born with jaundice, baby born with low birth weight. Male sterility is related to orchitis, undescended testis. False answer: viral hepatitis B, poliomyelitis, tetanus. Details: 4 cause of infertility: hypothalamic or pituitary disorder, gonad disorder, orchitis, undescended testis, sperm transport disorder, unknown causes. Vital statistics includes birth, marriage, death. False answer: migration, social mobility. Vital statistics deals with data on vital events in human life: natality, birth, morbidity, sickness, mortality, death, fertility, marriage, divorce. Vital statistics include birth rate, death rate, natural growth rate, life expectancy at birth, mortality, fertility rate. An ideal contraceptive should not be irreversible, effective with least side effects, easily available, an ideal contraceptive should not be irreversible, costly for target people. False answers: user friendly, effective with least side effects, easily available. The demographic process comprise mortality, marriage, fertility. False answer: morbidity, social evolution. Demographic processes includes fertility, mortality, migration. False answer: divorce, separation. Population policy formation requires size of the population, fertility rate, density of population. False answer: distribution of the population, age ratio. Demography includes fertility, migration, mortality. False answer: fecundity, morbidity. Vital statistics includes birth, marriage, death. False answer: migration, Vital statistics include birth, marriage, death, social mobility. False answer, migration. Social mobility includes true answer, rural to urban movement, change in income state, change in social status. False answer, marriage, change in political ideology. Vital statistics include all except true answer, migration. False answer, birth, death, morbidity, marriage. Benefits of exclusive breastfeeding are child grows well, child suffers less infectious disease. False answer, child needs no vaccination, mother needs no extra dietary energy, prevent conception up to 1 year. Demographic processes are true answer, fertility, mortality, migration, social change. False answer, fecundity. Demographic process, fertility, mortality, marriage, migration, social mobility. Postcoital contraception includes true answer, intrauterine contraceptive device, hormonal method, post-conceptional method, progesterone only pill. False answer, vaginal ring. Vital statistics include all except migration. False answer, birth, death, morbidity, marriage. Source of primary demographic data are true answer, population census, record of vital statistics, report of demographic and social survey, published demographic yearbooks. False answer, published journals. Sources of primary demographic data are true answer, population census, record of vital statistics, report of demographic and social survey, published demographic yearbooks. False answer, published journals. Details, source, population census, national sample survey, registration of vital event, ad hoc demographic studies. Absolute contraindication of oral contraceptive. Answer, liver disease, cardiac abnormality, abnormal uterine bleeding. False answer, migraine, diabetes mellitus. Demographic process includes social mobility, fertility, marriage. False answer, fecundity, population momentum. Superiority of breast milk over cow's milk are breast milk is free of contamination, contains more iron, easily digestible, nutritional value is more in breast milk. False answer, Protein is more in breast milk. The main indications for artificial feeding are mother suffering from fever, diarrhea, prolonged illness of the mother, and failure of breast milk, phenylketonuria of the baby, false answer diabetic and hypertensive mother, syphilitic mother. The following are the sensitive indicators of family planning achievement. True answer general fertility rate, total fertility rate, abortion rate. False answer growth rate, birth rate. Factors affecting fertility: age at marriage, duration of married life, spacing of children, education, economic status, religion, nutrition, family planning. Fertility related statistics: growth, birth rate, general fertility rate, general marital fertility rate, age specific fertility rate, age specific marital fertility rate, total fertility rate, gross production rate, net reproduction rate, child woman ratio, pregnancy rate, abortion ratio, marriage rate. Causes of high birth rate: universality of marriage, early marriage, early puberty, low standard of living, low level of literacy, traditional customs and habits, women must marry and must have son, absence of family planning methods, children are considered as a gift of God. Some important terms: vital event, live birth, death, fetal death, marriage, divorce, adaptation, legitimation, recognition, annulment, legal separation. Vital statistics: birth rate, death rate, fertility, life expectancy at birth, mortality, natural growth rate. Demographic process: birth, death, marriage, migration, social mobility. A carrier is an individual who harbors the organism but is not infected as measured by serological studies. A carrier is an individual who harbors the organism but is not infected as measured by serological studies.